What if the person you love slowly forgets your name, your face, even the life you built together? Alzheimer's disease treatment is one of the most urgent medical challenges of our time, and today we're breaking down what truly works, what doesn't, and what gives real hope. Welcome back to Balanced Motion Health, where we turn complex medical topics into clear, practical knowledge you can use. Today, we're diving deep into Alzheimer's disease treatment, not myths, not miracle cures, but real, science-based strategies that doctors use right now. If you or someone in your family is facing memory loss, confusion, or a diagnosis of Alzheimer's, this video will give you clarity and direction. Let's begin with something important. What is Alzheimer's disease? Alzheimer's disease is the most common cause of dementia. It's a progressive brain disorder that slowly destroys memory, thinking skills, and eventually the ability to carry out simple tasks. Inside the brain, two major problems happen. Amyloid plaques build up between brain cells. Tau tangles form inside brain cells. Over time, these changes damage and kill neurons, especially in areas responsible for memory and reasoning. And here's the hard truth. There is currently no complete cure for Alzheimer's disease, but that does not mean there is no treatment. Let's talk about what treatment actually means. What does Alzheimer's disease treatment really mean? When people hear treatment, they think cure. In Alzheimer's, treatment means slowing progression, managing symptoms, improving quality of life, supporting caregivers. The earlier treatment begins, the better the results. And this is critical. Early diagnosis makes a huge difference. Now let's break down the real medical treatments available today. FDA-approved medications for Alzheimer's. There are two main categories of medications currently used. 1. Cholinesterase inhibitors. These drugs help boost levels of a brain chemical called acetylcholine, which is important for memory and learning. Examples include donepezil, rivastigmine, galantamine. These medications are commonly used in mild to moderate Alzheimer's. What they do: improve memory temporarily, slow symptom worsening, help with attention and thinking. What they don't do: they do not stop the disease completely. They do not reverse brain damage. Side effects can include nausea, diarrhea, and sleep problems. 2. Memantine. Memantine works differently. It regulates glutamate, another brain chemical involved in learning. It's often used in moderate to severe Alzheimer's. It may improve thinking, reduce confusion, help maintain daily function longer. Sometimes doctors combine memantine with a cholinesterase inhibitor for better results. But here's where things get more interesting. Newer disease-modifying treatments. For decades, treatments only managed symptoms. Now, newer drugs are targeting amyloid plaques directly. Recently approved medications aim to reduce amyloid buildup in the brain. These drugs represent a shift from symptom management to targeting disease biology. However, they are most effective in early-stage Alzheimer's. They require careful monitoring. They may have serious side effects like brain swelling. They are not for everyone, and accessibility can be limited depending on country and cost. But they show something important. Progress is happening. Non-drug Alzheimer's disease treatment. Here's something many people overlook. Medication is only one part of treatment. Lifestyle and environment can significantly impact progression. Let's talk about powerful non-drug strategies. Cognitive stimulation. Keeping the brain active matters. Activities like reading, puzzles, learning new skills, social interaction. These help maintain neural connections longer. Isolation makes symptoms worse. Engagement slows decline. Physical exercise. Exercise increases blood flow to the brain. Studies show regular physical activity can slow cognitive decline, improve mood, reduce anxiety, improve sleep. Even 30 minutes of walking 5 days a week can make a difference. Nutrition. There is no magic food, but diets like the Mediterranean diet, rich in vegetables, olive oil, fish, nuts, are associated with slower brain aging. Avoid excess sugar, processed foods, heavy saturated fats. Good nutrition supports overall brain health. Sleep. Poor sleep accelerates cognitive decline. Deep sleep helps clear amyloid from the brain. Treat sleep problems early. It matters more than most people realize. Managing behavioral symptoms. Alzheimer's isn't just memory loss. Patients may experience agitation, aggression, anxiety, depression, hallucinations. These symptoms are often more distressing than memory issues. Treatment may include structured routines, calm environments, behavioral therapy, in some cases, medications. But here's a critical point. Antipsychotic medications must be used cautiously. They carry serious risks in elderly patients. Always discuss risks and benefits with a qualified physician. The role of caregivers. Let's pause here, because Alzheimer's disease treatment is not only about the patient, it's about the caregiver too. Caregivers often experience emotional burnout, financial strain, depression, physical exhaustion. Support groups, respite care, and family involvement are essential. No caregiver should do this alone. And if you are a caregiver watching this, your role is heroic, but you must protect your own health too. What about supplements and natural cures? Let's be honest, you will see claims online about coconut oil curing Alzheimer's, herbal mixtures reversing dementia, miracle brain supplements. There is no solid scientific evidence that these cure Alzheimer's disease. Some supplements may support general brain health, but none have proven to stop or reverse Alzheimer's. Be cautious. If something sounds too good to be true, it usually is. Always consult a medical professional before starting supplements. Future of Alzheimer's disease treatment. The future looks promising. Researchers are working on beta amyloid targeting drugs, tau protein therapies, anti-inflammatory approaches, gene-based treatments, blood tests for early detection. Earlier detection means earlier treatment. Earlier treatment means better outcomes. We are not where we want to be yet, but we are moving forward. A real-life perspective. Imagine a grandmother who begins misplacing keys, then forgetting appointments, then forgetting names. Early diagnosis allows her family to start medication early, adjust lifestyle, plan finances, prepare emotionally, create memories while she still remembers. Alzheimer's disease treatment is not just medical, it is planning, it is adapting, it is preserving dignity. Let's summarize clearly. There is no cure yet. Medications can slow progression. New drugs target amyloid plaques. Lifestyle changes matter greatly. Caregiver support is essential. Avoid miracle cure claims. Early diagnosis is critical. Knowledge is power, and informed action makes a real difference. Finally, if you found this breakdown helpful, share it with someone who may need clarity about Alzheimer's disease treatment. Too many families face this condition without accurate information. Subscribe to Balanced Motion Health for evidence-based, easy-to-understand health education. Leave a comment below. What questions do you have about Alzheimer's disease? And remember, even when memory fades, dignity, love, and human connection still matter. Stay informed, stay strong, stay balanced. See you in the next video.